Yeah, go ahead, good.
What does working out with weights do to your heart?
It causes more load on the muscle, so it makes your muscles pump more blood to the area. If I have to pump more blood to the area, like putting my hand in cold water, at that point, that blood has to go there very, very quick rate. So it makes your heart work harder to pump more blood to the area. Your heart is your pumping mechanism to get things through the body. So by doing the weights, which I like, allows you to move that blood faster and harder. Some people can work out just with weights, not do any cardio, and you're running or jogging or walking, and get the same effect if they push your body hard enough with the weights. If you do your leg workout properly and work out with weights with your legs, that blood has to go from your heart to your legs quickly. That causes you to feel like you're out of breath sometimes. For that reason.
My son works a lot with CrossFit.
Yes.
Exercise and everything. Not necessarily with weight,
It's even body weight's fine too. Because it's quick interval training. With CrossFit, the way the CrossFit workout goes through, their program is you want quick exercise for about maybe 30 seconds to a minute, a quick break, another exercise, quick break. So their heart rate goes up and down. It's interval training up and down, up and down. That change in intensity in the workout, the change in intensity, allows your heart to get confused. Doesn't know if it's going to go up or down. Cause more stress on the heart sometimes. It depends how old you are and how your heart is. It's sometimes a good thing for your body to get through that temporarily for a short burst of workout. The problem is if you're, unlike CrossFit, maybe lasts half an hour, 45 minutes, maybe an hour the most. That's where your body hits that wall. It starts breaking down tissue versus helping tissue. So you have to watch your body with CrossFit to make sure you're ready for it initially, you're in good health, and then watch how you respond to it also. Once you've done it for a while, your body will adapt to it. Realize sometimes that can be too much for your body. And even in going back to exercise too, a certain exercise can cause issues that are bad for the heart or your circulatory system, even marathon running too. Marathon runners are kind of addicted. I've done it several times before marathons. But you're at a constant high speed for one, too. Your circulation has to basically pump blood at a high rate the whole time, anywhere from 2 to 4 hours. So at that point, your body hits a stress level, besides breaking down the heart tissue, for that to occur. If I work on my muscles too much, what happens in the muscle? It can tear. Same thing with the heart. The heart doesn't go, ow, you have a torn muscle. It goes, you're going to have a heart attack. That's why in marathons, especially in marathons, they don't talk about it. There's usually one heart attack every marathon. Doesn't make the news, but one heart attack every marathon. So you have to be very careful how you push your body. Again, I have some people do marathons, they go at their own pace, they're fine. When you push yourself hard enough, it can cause an issue. I was in a marathon, LA Marathon, I want to say, date myself, probably 2002, 2003. I was at a fast pace. I was about a 9-minute pace versus my usual 10-minute pace. Mine's kind of quick, but I'll stick to my pace. I see a guy lying down, ambulance pulling up, and cops kind of surrounding him, kind of give him some closure, some privacy, and find out later in the news he was one of the faster guys in the race. He was a USC student, 20 years old, took amphetamines to get his heart rate up before the race. So his heart rate when his race started was high, like here, because he was already racing. His heart rate with amphetamines. By the time he started racing, it went at such a high level, he had a heart attack. This is mile by Century City, so by mile maybe 5 or 6. Wasn't very far in. Heart attack, 3 days later, he died. USC student, 20 years old.
Question.
Yes.
The big bodybuilders, I was wondering, doesn't that put a lot of stress on their body and they're so huge?
It does, but it depends how they got there.
Okay.
So if they worked out, see, most bodybuilders are what they call strongman competitions too. One guy I did an interview with him probably last April, I think. He does a very long warm-up to get to that point where you can do that heavier weights. But you got to get there properly. If you do that, then you're not going to tear anything, cause heart issue, other issues too. You can tear muscles very easily that way. But you have to do a big warm-up and warm down to get there. There's a lot of preparation for those heavier weights to get to that point. If you don't, then you're going to have a lot of problems. It's how you train. See, the marathon's not bad, but the marathon, you push yourself so hard in the marathon where your body's being pushed, where you feel your heart the whole time, like I've done in the past, you're causing things to break itself down. The heart, unlike other parts of the body, it doesn't repair as much as a muscle in the skeletal area. Say a quad muscle or a bicep muscle. It takes a lot longer to heal. So be careful, even though it's a muscle, it's a different type of muscle fibers, it doesn't heal as quickly as the parts because the heart realizes, like you're breathing, it never stops. If I tear my bicep, I'm going to be put in probably a cast where I'm not going to be able to move it until it wants to heal enough, where the fibers can heal. Problem the heart, it never stops. So once you start tearing the muscle, it starts breaking down, it's hard for it to heal. Even if you stop exercising. Yes?
Knee problem. Okay, it's very, very painful on the inside of the knee.
Yes.
And I keep it wrapped because it becomes quite painful. How can I exercise my knee when it hurts so bad?
Good. So that was, as I had this before too, because right now you don't want to cause load on it, right? If you walk on your knee and you have a bad knee, what's going to happen is you're going to feel it's getting worse. It's going to change your gait, change everything in your body. What I would do is take the load off of your knee and work out that way. Your knee consists of a patella kneecap, joints on both sides, top and bottom. So you have basically 4 joints, ligaments front, which is your quad muscle coming down below your kneecap right here and attaching below your kneecap. Muscle on the side, muscle underneath your hamstring, along with the whole quad muscle coming from here all the way up and down.
It's the inside part of the knee.
So the MCL, it's called the MCL ligament, or the VMO muscle, is part of your quad muscle that gets very weak sometimes, weak and swollen. The problem is with the knee is you have your knee, your quad muscle, right? The outside muscle is a secondary muscle called the ITB band or tensor fasciae lata if you're French. At that point, that muscle or tendon makes the kneecap pull away from the knee, pull from the outside. When you have that issue, then when you walk, the inside muscle is weak, so it causes more knee pressure on that joint area. So when I walk, if I have that tighter muscle on the side, it pulls it over. The kneecap goes this way instead of going straight up and down along the seam of my pants. Exactly. So we got to get it stronger. Okay? Let me show you right now. Take a quick break from our normal talk. How do we get the knee to get stronger, especially inside knee pain? Is what I'm going to have you do. Let me say right here, and you can probably do it. Yours is going to be fine. You want to bring your foot out for knee extension this way. So I'm going to have you bring your foot out this way. There we go. Now come up and down, straight up and down. How does that feel?
I feel it.
Good.
I feel the pain.
Good. Does it feel pain or tight?
No pain.
Good. Good. I'm saying good because I want you to have some pain.
That's good.
Yes. I want you to be sore so cause more blood flow. If you're sore, your body goes, I got to send blood there right away. But what you're going to do though, you do about 10 of these. Come up, hold. Start with 5, baby. Come up, hold. Get that muscle tighten up in that area, in that kneecap area. Up, hold 5 times. Once you're done with that, you got to promise me you're going to ice it down.
Okay.
Because you cause blood flow, right, for the healing. Blood has minerals, vitamins to help tissue to heal and repair. Now you want to ice so it doesn't swell.
Yeah, it is swollen.
So it's swollen because right now there's not enough motion.
I keep it wrapped.
So I would, right now, because it's swollen, I would do is ice it first, do your exercises, feel a little bit of pain, a little soreness, then ice it again. And when you ice it, lie down with your knee above your heart if you can, even just put a pillow underneath your knee, and ice it that way till it feels numb. You're too young for heat, that's for old people. Right? Only the ice pack.
Yeah.
Does that make sense?
It would, yes.
Well, let me know in a month if it makes it worse than it was he said it, not me. All right? But that's the thing. Can we cause more motion, then more circulation, then the icing to calm down the swelling inflammation, so you have the benefit of the blood flow for heal and repair without the swelling causing more pain afterwards.
I see.
That's the issue. Sometimes what happens, pain limits our ability to do things, tells us to stop. Sometimes you go, okay, what kind of pain is it? What is it doing? I got to move to get out of the pain. Versus we're being told, even by our doctors, if it's painful, stop. You have to move to get through the pain. They make your body stronger and looser at the same time. Again, if we're looser and strong, we have more motion, more circulation, more blood flow, everything works better. Okay? Let me know in a month. Again, if it's good, it's not, then it's that guy.
I have
Yes.
a question. In terms of this weather and getting blood flow to your extremities because it's so cold,
Yes.
like your fingers and your toes and the tip of your nose because it's so cold. I mean, you can put gloves on and extra socks, but still, you know,
It's tough.
Luckily, we're not in, you know, Wisconsin.
Yeah, we're not -20, -30 like some places.
Yeah, so how do we get that kind of blood?
Just keep moving and try not to go in that cold weather. You can't fight Mother Nature.
Yeah, I know, but so you just keep your fingers moving.
Keep your fingers moving.
toes tapping?
Exactly. And if you're going to walk outside, especially, make sure you even try to get your feet to rub a little bit too inside your shoe. Even if your shoe a little bit too on the floor, to get that blood pumping. You just clap your hands, whatever you can do, get that blood moving.
And what about like your nose?
Give yourself in the nose. No, I'm kidding. Like we talked about earlier too with Carlos, is cover your face up. Use your breath, because your breath comes from your lungs when you exhale, to get that heat from your lungs to keep your face and your body warm. And obviously you want to put something on your either hat or a hood to make sure your head doesn't lose the heat too. But having that mask, or let's call it a gaiter or a scarf, keeps that heat trapped inside your body here, so nothing going in is going to be cold air.
Okay, and then for blood flow, it's just movement of...
Movement, rubbing your hands, whatever you can do. I read a book by Jack London. He talks a lot about the Klondike, Alaska area back in the 40s with the gold rush up there. And what they would do is just bang their hands together, bang their hands, they would freeze up against a tree, or if their feet against a tree, whatever they could do to get things to wake itself up. There are tough people back there, men and women. But that, Carl's question. Yes?
Talking about cold and muscles. And stuff.
Cold muscles.
Reminded me of when I lived in Colorado. This gentleman was jogging out of the dirt, out in the country. And a friend of mine was watching him come, and it turned, and it was very, very cold out there. It was like in the 30s.
Yeah.
And this guy is running in shorts.
Yep.
And when he came around the bend right in front of his house, he fell. He fell to the ground, and his both legs had come up, his feet had come up all the way past his leg, past his hip. The legs, both legs had come up on the side like this. It was screaming blood. Why do people run in freezing cold weather in shorts?
Humans are humans, my friend. Humans are humans.
Right.
Humans will test themselves to see how much they can push themselves beyond a limit, maybe running a certain distance or running and how much you wear. Again, I've done marathons where it's freezing rain and guys are out there in shorts and no shirt at all. I go, no, I'm wearing my shirt, my jacket, my weatherproof, my plastic over me, so I'm going to stay warm. Because you need that body temperature. So I feel great. I'm like, well, good for you. But then you're pushing your body so hard, you're causing running, right? Running's going to increase your heart rate, increase your lung capacity, increase circulation. Sometimes beyond what you're used to, what you can handle. Now you're causing your blood to go to your extremities. You're causing such a high blood pressure change that can cause a heart attack immediately. You're causing too much of a change in your body. You can't adapt to all those stressors. Like the finger's frozen too. It sends blood in the area. Now you want blood there, but you also want blood here. You want blood here. How much blood are you going to get in your body? You're causing a lower blood pressure event where your body has to increase it so high it goes above it can handle. That could cause your heart attack. Or blow out your knees like the guy. Whatever that guy was doing. I don't know. And if you realize sometimes drugs or medication cause issues too, where you feel hot or too cold. Realize it's your body, right? Listen to your body. If your body's too hot or too cold, that can correlate with either high blood pressure or low blood pressure. Listen to your body. If your body's too cold all the time, especially extremities of your feet or your hands, even at the normal room temperature, do you have a blood pressure issue? Maybe. You have to get tested to make sure.
I've heard a lot about a person losing a lot of its body heat through the head.
Yep.
Is that really true?
Yes.
Does that really happen?
Yeah, it does. Through your head, neck, the whole head area, neck area. So you want to make sure if you're in a cold area, you have a hat or something to cover your neck and your shoulders. A beanie. It's about a hood or something. At that point you have that body heat coming down versus leaving your body. Does heat travel up or down? Up, right? Common third grade knowledge. So if it travels up, can you cover that area so it stays in versus leaving the areas? So maybe not just the head, but the whole neck and shoulders where the heat can leave your shirt. So you have to make sure you cover that. It's cold out there, people. Like I said, I don't go out there. I go, yeah, it's 42, I'll be working out inside today. I'll not be on the streets. But realize we're different, right? I mean, I have a dog, small German Shepherd Rottweiler mix. Doesn't matter how cold she always wants to go outside. She wants to go for a walk every morning. Every night. I just put a coat on her, so my wife doesn't get mad at me for not putting the coat on her.
Yeah.
But she has fur. What does the fur do? It protects them insulation. Like our clothes, animals have fur. That's the benefit. Okay. Who takes supplements, not medication, supplements for blood pressure or heart conditions? What kind of supplements do you take?
The heart, it's about 5, I don't remember.
What is it?
The folic acid,
Good.
iron,
So folic acid, iron.
I forgot. They're in a little container.
Why do you take supplements for your heart and high blood pressure?
Because it was recommended by my doctor.
And those are things that allow the blood flow to happen naturally, keep the blood flow normal. But I realize with iron, even to vitamin D, it keeps that lining of the arteries nice and loose and elastic. That's the plan.
Yeah.
You make things elastic enough so you can handle high blood pressure, low blood pressure, but maintain that blood pressure overall the system normal and natural. That's why supplements are really good. I even take turmeric myself as an anti-inflammatory to keep my blood at a normal level, but also as a blood thinner too. Because I have hereditary factors that my father and grandfather both had heart attacks. So I keep my blood pressure, I monitor that as taking vitamins to reduce my risk of having a heart attack. It helps with inflammation too. So you have to realize wherever you are, can you start doing things today a little bit more, or look into something, hey, what else can I do? Can I take a tablespoon of olive oil every day, or coconut oil? Same thing, that's what I do, coconut oil every day. At that point, it keeps my body healthy. Realize even coconut oil is antiviral, antibacterial, antifungal. Helps fight off when you get a cold or getting sick.
You said coconut oil?
But not from allergies like I have. Thank you.
You said coconut oil?
Coconut oil. Coconut oil is antiviral, antibacterial, antifungal. So it allows you, even though you get the oil benefit of keeping your LDLs higher and having a better cholesterol ratio, helping blood pressure too, also keeps your immune system strong. Coconut oil, same thing. And coconut oil, I think, is more antiviral, but not really bacterial or fungal. But again, just good for your overall heart.
Coconut oil seems to solidify.
It's more solid, right? Yep.
It doesn't stay liquid very long.
Exactly. Yep. But it's still an oil, it's still a fat. So once it gets to room temperature, or even body temperature, you can put it on your skin. People use it for skin too. At that point, it becomes liquid. But at room temperature, it does stay more solid. That's why it has a higher melting point than olive oil does.
What are the benefits of putting it on your skin?
Allows
you drinking it.
Because your skin will still go through into your bloodstream.
Oh, okay.
Especially thin parts like your armpits or your feet, bottom of your feet. If you, like myself, wear shoes most of the time in the winter, your skin gets very thin, so it allows it to go right to your bloodstream. And just a topical keeps your skin from getting dried out. I even use a coconut oil base skin lotion. So I look like I'm 25, but I'm 65. Anyone get that? That's why I use my skin. That's why I use skin lotion. That's why I buy oil for my face. My face lotion. I look like I'm 25, right? But I'm actually 65. Good. You guys got it. Good. Good. Yay. Guys, you're awake. Fantastic. Yay. I'll send you the videos, watch the video later. You can listen to it when you're awake. Any questions so far? Yes.
Well, vinegar.
What's that?
Vinegar. I got a 107-year-old mother-in-law that drinks a tablespoon of vinegar every morning.
What does the vinegar do? Do you know?
I don't know.
It cleans out our system.
Blood thinner?
It's more antimicrobe. Just anything gets in your body that can cause an infection, like a bacteria or virus, it helps kill everything like that. It decreases, but vinegar is a very basic, it's a pH base, so acidity versus basic. It drops so it kills anything that can't handle that lower basic level. When you drink it, a lot of your microbes or viruses or bacteria happen in your mouth or your esophagus. By doing that, you're killing a lot of what it can actually affect your body inside. Some people will do like hydrogen peroxide in the morning as just a gargle in their mouth to help clean out their mouth that way too. All right, but yeah, good luck. She'll be 140. But those things work, right? Why, if they work, then keep doing it for you. My grandmother, the same thing. She used vinegar on her skin every day to clean her body. So she passed away at 93, but died at 93 healthy. A lot of whatever works for you. At that point, you get better numbers from your doctor when you get your blood test done. Keep doing it. Try some for 30 days. See if that causes your numbers to get better. See if you feel better. And if you have a family history of it, then you have to be really diligent, like myself. But what can I do now at 65 or 45, like I really am? At that point, and do what I got to do so I can be 65, 107, 93, wherever I want to go to, by doing something now every day as my routine. Yes, Carlos.
My daughter is your age, and her blood pressure is way higher than mine. She's taking the Ciropril every day, but it doesn't seem to want to come down.
Well, and every patient, every person is different. Realize blood pressure, realize heart issues, cholesterol issues is also affected by stress in your life. It's not just what you do to your own body, what's going to your body, what's affecting your body stress level wise, physically and mentally. Your body will adapt to the stressors of your body. If I watch a scary movie, because I get scared easily, I'm going to scream, I'm going to have some heart issues for hopefully very temporarily. You know? But that will be last very temporary. Turn the movie off, I go into a safe place where it's light, and I forget about the movie, I'm fine. People are under stress every day from they wake up in the morning till they go to bed. Based on driving to LA for work every day, I drive to Long Beach every day for work. 2 hours every day, back and forth. They deal with kids every day. They don't know how to relax their body. They don't have relaxation techniques that works in their body. The body stays under stress. That stress affects your heart, so your heart beats faster. Heart beats faster, it's a muscle, right? Doesn't have time to rest. It starts tearing the muscle of the heart. What happens to your arteries? You start eating poorly when you're under stress because it makes you want to feel better when you eat poorly. Say bad fats, high sugar, whatever it might be, your arteries get clogged. What are small arteries that can get clogged very easily? Your brain arteries. Very thin, very small, causing your brain aneurysm. When your blood pressure is high, that's your sign. Hey, what do I have to change physically to my body with exercise or nutrition or breathing or ways to relax or my environment that's affecting my body to make my body less stressed?
Yeah, she has a lot of migraines too.
So I'll figure out with me is, okay, what if it was me, I'm having high blood pressure, a lot of migraines, which is another effect of that. What can I change in my lifestyle, meaning what I can control, my diet and exercise, the ways I relax, stress, yoga, breathing, whatever it might be. Well, what can I decrease the stressors in my life to make my body less stressed? And the third thing, how can I get my body healthier so I can tolerate more stress around me? See, my patients, I'm not going to tell my patients to change your job. Leave your kids and your husband or wife. Especially around Valentine's Day this week, right? Alright? Or drop your dog off at the dog pound. But can you make your body stronger and healthier, tolerate the stress around you so it doesn't affect you every day? It's not the one day of stress, it's the Tuesday, Wednesday, Thursday, Friday, Saturday, and next week, next month, next year. How do you tolerate more by changing what you do inside your body or outside? That's the key. Inside. But the blood pressure test tells is your warning sign, uh-oh, what do I want to do? Do I want to, yeah, big camera guy. Everything here. So what part did I miss?
Right when you started the closeout.
Okay, so my closeout is here. Is that?
Bye.
Oh, sorry. Closeout. Thanks for coming, guys. Is how do we decrease the stress in our life around us? If we can't do that, by leaving our kids, husband, wife, dropping dog off the pound, how do we change our inside? How do we eat better? How do we have better oils in our body, such as coconut oil, olive oil? Okay. How do we decrease the bad fats in our body, such as canola oil or anything fried food, especially at a restaurant? Okay. Again, minimize what you're doing. We have to live a normal life, right? Can we decrease some of that increase some of the good stuff over time, change our body. Realize it takes about 30 days for our body to chemically and neurologically change inside the body to see the overall health benefit. By getting a blood test done, maybe once a year or even more often, allows your body to see that overall benefit. Are my numbers changing so my heart is better because my cholesterol is lower? My blood pressure is a better normal limit. Okay? Even motion too. Again, motion allows your body to move more, causes circulation, more blood flow. So your heart pumps enough. Being a heart needs to pump, cause the muscles to work properly. Even arteries, get those arteries to expand and elastic. At that point, things work properly. Even your veins too. And lastly, make sure you breathe enough. We breathe now, right? Can we deep breathe? Can we do deep breathing through our nose? Catch this, Herman?
No, we're hitting this, yes.
Good. So through my nose, right, increase my lungs, and my chest cavity increases too. Hold it for 2 seconds and breathe all the way out through my mouth and push my air through my abdominal area where it all comes out. That when you circulate that oxygen, your body can function better, have better results of brain activity and organ activity. Okay? So decreasing the stress in your heart is decreasing everything in your body, make your body become less stressed, more relaxed. You can handle when you have an exciting event, it doesn't cause a heart attack. You shouldn't have problems. You get up and down, you have blood pressure issues. We have to change our lifestyle sometimes, what we're doing, and do little things like this so you see the overall benefit. Any questions beyond that? Yes?
I'm sorry, but when you are talking to us here in a home that we are, do you ever do anything as far as speaking with the kitchen staff and so forth?
Not yet. That's more of the corporate, more of the business side of everything. It's doing what you can control.
Well, most of us can't control.
And what I would do, if it's okay, if there's policies here that may discourage it, is having a bottle of olive oil in your room or coconut oil, and just having a teaspoon of that every day, just to start a change in your diet. If that's policy, I'm not sure. Brian?
It may not be the policy, but it may not be possible.
Okay. So and then you have to.
I said it may not be the policy, but it's not possible for us to do that.
It's possible.
It's possible.
When they do their meds,
Yeah.
then they can't have nothing over the counter. But if they do their own medicine, they can have that.
So it's depending on what you're.
Yeah, but they can bring it up to the family to buy that, and they can go and they get a doctor's order, and it can be given with their.
Yeah. So it's a procedure that has to go through.
Yeah.
And realize that again, sometimes all the coconut are normal things, right? For some medications, that's why you want your doctor to look at it too, or your pharmacist. Some medications may be counteracted to have an oil like that because it can decrease the effect of medication or cause an adverse reaction.
I was just curious in a place like this.
And because it is a place like this, you have to make sure you're doing the right things for you too. So you have to make sure, okay, what is the policy on this, and how do I get this in here? Again, if you can bring a family member to get that note, get that in there for you too, at that point, take care of it. And that's why some people will want to do heavy supplements, heavy other things, or these organic things or oils. The problem is that's not practical for everybody. You can't get all that stuff. You can do little things here and that I'm trying to give out to change something for a long-term effect. Especially like myself, I've had a history of having heart attacks. I do myself, so inside a place like this, you have to really watch what you do. But yeah, doctor, staff, they can help you out, see what's going on.
Thank you.
Right, anything else? Carlos, anything else? All right, Ryan, anyone? Ladies, good? Were you entertained? Did I entertain you? Say, was it fun? Did you have a fun time?
Oh, it was extremely interesting.
Good. I didn't have to dance today to entertain you. Good. Thank you for coming. Appreciate your attendance. Sorry so long today. Shorter next time.